What's up, YouTube fam? I'm back with another video. I have a guest here. Before we get into the meat and potato of today's video, please show my comment section and my social media links some love. I'll leave the links to my social media sites in the description box below. So a few weeks ago, I said, look, I got someone coming on. We're going to have a really good conversation about health, diabetes. I'm not going to get too much into it. I'm going to let her do her thing. So, Ms. Denson, why don't you introduce yourself to my fans?
Okay. Well, hello, fans, and thank you for being with us today. And thank you for inviting me.
Of course.
So I'm Sylvia Denson. I'm a registered nurse. I'm a graduate of Dillard University. I have over 40 years of nursing experience. I've done many different types of nursing. Presently, I am a diabetes programs coordinator and diabetes nurse educator for a federally qualified health center. And I do some other things as well as work with churches and church nurses and what's called the Church Nurse Program through Baptist Community Ministries. So, you know, I do a lot of stuff. I really love being in healthcare. I believe that health is very important for all of us. I remember when I was a very young nurse and I met a patient and the gentleman was a very wealthy patient, but he was very unhealthy. And he said, no matter how much money I have, it's not enough to bring my health back. And so
that's a true statement.
So just know that your health is very, very important, and it is tantamount to your wealth. Your health is your wealth in many ways. So again, thank you so much for inviting me.
Of course.
And, I'm excited just to be here.
I'm glad that you came with this energy. I appreciate it. So, Miss Sylvia, I have to ask, what made you get into nursing in the first place anyway?
Well, the reason I got into nursing is because I needed my mother. Now, what does that mean? My mother, at 32 years old, lost function of her kidneys and needed hemodialysis, or just dialysis. Well, at that time, when that happened to her, there were no dialysis centers anywhere, no outpatient dialysis centers. The only place you could get hemodialysis would be at Charity Hospital. And the patients were coming so fast that they didn't have enough room. So the only way that you could survive as a person living without the function of your kidneys at that time was you had to have a loved one learn how to dialyze you at home so that you could live, because there was not enough space at Charity Hospital to take all the patients that were coming in. So I, at my 13-year-old self, said I need my mother. And my father was trying to learn, but my father was father of 9 children, a wife, so he had 11 people to take care of, and he worked 3 jobs, and he was trying to take care of my mother and learn how to dialyze. And so I just decided that that was going to be me. I was going to be the person to do that because I needed my mother in my life. So I, at 13 years old, began dialyzing my mother at home. From the time I was 13 until I was about 22. Yeah, so we did it for about 10 years at home.
Wow.
Until I was 23, actually.
Wow, I had no idea. Well, thank you for sharing your story. Definitely. You said that, in discussion before we got on, I remember you said that you specialize in diabetics. Mm-hmm. So before we get into that, what made you get into that area of expertise or specialization?
Into diabetes?
Yes, ma'am.
So when I started with the job that I actually have right now, I started as a nurse care manager. And a year after starting, they asked me to begin a diabetes program. And so that really was my start to becoming a diabetes educator. And it's been very rewarding for me, and hopefully as well my patients.
Okay. Mm-hmm. So give us some facts about diabetes. Like what's a good sign to know, if let's say if I didn't know anything or the general person doesn't know? Like give us some signs and symptoms that you potentially might be a diabetic and you're unaware of it.
All right. That's a good question. That's a very good question. But if you don't mind, what I like to do is
Ah,
I like to tell your audience what puts them at risk for becoming a person living with diabetes.
absolutely. Let's go.
And your risk factor is just a character that increases your potential to have that experience. So, as a woman, I am more at risk than a man is.
Really? And why is that?
It's just the researched evidence and facts.
Okay.
So, as a woman, I'm more at risk. As if you're 40 years or older, you're more at risk. If your family, if you have a family history of diabetes, your mother, your father, your siblings, you're now more at risk for diabetes. If you already have high blood pressure, you're more at risk. If you have high cholesterol, you are more at risk. If you are sedentary, you're not exercising, you're not moving. Our bodies are actually made to move, ladies and gentlemen. And many of us are not moving. We're not doing any kind of exercise. So that puts us more at risk. If we're overweight, that puts us more at risk. The fact that we are African Americans or Latin Americans or Asians or Pacific Islanders, that puts us more at risk. What other things? And so, if you smoke, you're more at risk. If you're a woman who had a baby and you develop gestational diabetes during that pregnancy, you're more at risk. If you're a woman who has what we call polycystic ovaries, then you're more at risk. If you have a baby over 9 pounds, you're more at risk. So there are risk factors here
Yes.
that we can change, but then there's risk factors we can't change. I can't change the fact that I'm an African American woman and I'm more at risk. I can't change that, okay, I'm over 40 years old. I know y'all didn't think that. No, I'm just teasing.
Well, I didn't think that. But, they say black no crack, so there you go.
I can't help that I'm 40 years old. I can't change that, I can't change that my father was had diabetes. But I can change if I'm overweight. I can lower my blood pressure if it's too high. I can change my diet and decrease my cholesterol. I can change the fact that I'm sedentary. I can start exercising. If I'm a smoker, that puts me more at risk. So there's smoke cessation. I can stop smoking. So there are some things that I can do to decrease that risk. But there are risk factors that I can't change.
Wow.
So,
Well, you just gave us a plethora of information. I appreciate that. And I think everyone else does as well, too. When I was younger, and I think I might have told you about this earlier, my father, before he passed, there were certain episodes of confusion that he would have. And when I was younger, I wouldn't understand why. It just was scary for me.
Yes.
My mother, working at the hospital, she knew exactly what was going on.
Exactly.
So me going to EMT school and educating myself about it, now I know about it pretty well, or at least better than I did before. But those episodes of confusion are things that can occur due to diabetes being left unchecked, along with other risk factors that you just stated, correct?
That is true. That is true. There are many signs and symptoms that come with diabetes. A person might experience, like he says, his father experienced a point where he became a little disoriented and appeared confused. That can happen if your blood sugar drops too low. It can also happen if your blood sugar is too high. You can have blurred vision. You might have tingling in your hands or tingling in your feet. You could have the need to urinate all the time. You could find yourself losing a lot of weight really quickly. You can't stop going to the bathroom. You might find that you're very thirsty. You cannot quench that thirst, and you just keep drinking and keep drinking. And many times the problem with that is because we don't realize we're thirsty because our blood sugar is so high, we tend to go drink something that makes the blood sugar even higher. So many of us, when we are thirsty, we don't necessarily get water. We want some Hawaiian punch, or we want the sweet tea. from McDonald's, or we want that Coca-Cola. And guess what? All we're doing is increasing that blood sugar and increasing our thirst and increasing our need to go to the bathroom. And so again, there's many things that happen in your body when your blood sugar is high.
And I was just about to ask you, that's a good segue point to segue into what foods and or snacks should people stay away from if we want to regulate our blood sugar levels, because these might be things that people honestly just don't know.
Every food that we eat has some impact on our blood sugar. The foods in our diet that impact mostly our blood sugar is going to be the foods we call carbohydrates. Carbohydrates have 3 categories. We have a milk category, so anytime you eat milk, or you drink milk, you eat ice cream, you eat yogurt, you're eating a carbohydrate. Whether it's almond milk, soy milk, cow milk, goat milk, it doesn't matter which milk it is, they're all a carbohydrate. It doesn't mean that you can't have it. Then we have the fruit category. Every time you eat a fruit, you're eating a carbohydrate. Fruits have what we call simple sugar, or they have what we call fructose. Again, it doesn't mean that you can't eat fruit, because sure, we want you to eat fruit. Fruit have a lot of healthy benefits for us. Lots of fiber, lots of vitamins, minerals, but they also have lots of sugar. And then we have what's called our starchy grain category of carbohydrate. And that's going to cover all of your cereals and your breads and your rice. It's going to cover all your crackers and muffins and bagels and pancakes and waffles and all your cookies and donuts and, And then we have what's called your starchy vegetable category. And now that's a very important category. And the reason I say that is because they are vegetables that I'm going to call out, but they're what we call starchy vegetables. And those vegetables, when we eat them, it's just our bodies digest them just like we ate fruit, just like we ate milk or ice cream. They turn it into, the digestion happens, and that food is turned into what's called glucose. The reason that glucose is there is because we need it for energy. Okay? So, if you're eating corn is a vegetable, but corn is a starchy vegetable. So when you eat corn, you're eating a carbohydrate. You can't count it on your plate as if you're eating a vegetable. Same thing with green peas. You're eating green peas. Green peas are a vegetable, but they're a starchy vegetable. So when you eat them, your body turns it into that glucose. The same thing with your potatoes or your pasta, your rice. No, I'm sorry, pasta and rice is not a vegetable. But potatoes, white potatoes, sweet potatoes, butternut squash, your pumpkin, your mixed vegetables. If your mixed vegetables has peas, pasta, rice, potatoes, then you have to count that as a carbohydrate. And then there's ways that you can measure to make sure that you're not taking in more carbohydrate than your body needs. So there's a lot more to be talked about carbohydrates. I probably won't get it all in here today, but hopefully I'm going to be invited back to come back and talk to you more, because next month is, as well as being breast cancer awareness month, it is also diabetes awareness month. So I'd like, hopefully, to get invited back.
Of
and
course.
I get to talk about both of those awareness months and how important it is that we all understand how important it is for us to all take care of our health, be advocates for ourselves, and go get those doctor's appointments, or go get those blood tests, or whatever it is we need. Take our medicines. There's many other things that we're going to talk about, but again, cancer awareness and diabetes awareness, we're definitely going to cover those topics coming up in the following months.
Well, thank you for the explanation, Ms. Denson. I appreciate it, and I appreciate you so much for coming on, guys. And on that note, we're going to wrap things up. Remember to rate, comment, and subscribe. Go follow my social media links. Like I said, I'll leave the link in the description box below. And as you know, I'll be back next week with another video. Y'all have a good one.